So welcome to part 3 of chapter 13, the cardiovascular system, the heart. So now we're looking at a different aspect of the heart, the blood vessels. So before we begin this PowerPoint presentation, which is fairly brief, you should complete and submit the blood vessel worksheet on Blackboard. Do not do the one on pages 170 through 173 in the PowerPoint packet. This one had several errors and will cause confusion, so please complete the one that I've posted on Blackboard. Once you've completed the worksheet, then you should follow along in this presentation. The answer key to the worksheet will be posted on Blackboard after the due date. Also, to assist with the blood vessel concepts, you should complete the Learn Smart on Connect, the homework, and the quiz. The quiz for this week also includes the lymphatic system, which was a brief presentation. Complete and submit the Chapter 13 animation worksheet also on Blackboard. So what we're going to do is basically a very brief introduction. So in the worksheet posted on Blackboard, the first thing you're going to see is an artery person to label. So all you have to do is label it. You don't have to do anything else to submit on Blackboard. You will need to learn the words that I already have printed out. So what am I talking about? So on the worksheet, I have labeled numbers 1 through 18, and your job is on the left to match up the right artery with the right number. I have already provided where it's supplying blood to. The very first page is arteries. Arteries, if you recall, are going to carry blood away from the heart to the body part. So in other words, arteries carry blood or supply blood to a certain part. So for example, the left external iliac, the iliacs you can see kind of in this picture, are going to supply blood to the left lower limbs. So all of these, as far as where they're supplying blood to, you should also know. So be able to label and give a brief description of where these blood vessels are going. A lot of these are going to also be seen when we get to veins. So let's just trace a few to look and see what's happening. So we're going to start off with the aorta. So in our discussion for the heart, the aorta was a major artery that carried blood away from the body. The aorta branches into aortic arch, and you also have what's called an ascending and descending aorta. So all of these structures are listed in this picture. So basically what's happening is you're looking at, kind of think of this like a highway, and it's changing names. It's the same highway, it's just changing names according to where you are. So the aortic arch will then split and have 3 major branches: the brachiocephalic, the left common carotid, and left subclavian. And if you keep tracing it, the left subclavian or right subclavian, think subclavicle, below the clavicle, they become then what's called axillary. So axillary supplies blood to the armpit. If you keep tracing the axillary, just kind of keep going along on this picture, you get to what's called brachial. It's kind of by your bicep. And if you keep tracing that brachial, it splits into radial and ulnar. You should recall that you have a radial and ulnar bone in your forearm. In the bottom half of your body, so find the diaphragm, it's almost forming an upside down Y. So the very large artery, that kind of the stem of the Y, is called the descending or abdominal aorta. In this picture, it's just labeled aorta. It's the same structure. Branching off the aorta are major arteries to major parts of your body. So splenic is going to be your spleen. Renal is going to supply blood to your kidneys. Superior mesenteric, so superior means above. Mesentery, you have lots of mesentery in your digestive tract, so small intestine, liver, etc. Hepatic is going to be liver. Then we have inferior mesenteric, so that's below the superior. It supplies blood to the lower portions of your digestive system. And then we have something called common iliac. It's kind of right where that Y is going to split. If you recall, you have an ilium and an ischium in your pelvic bone. The external goes to your lower limbs, and the internal stays by your pelvic cavity, supplying blood to your reproductive organs and urinary tract. Your femoral artery is in your leg by your femur. So all of these arteries supply blood to these body parts. You can see a list of that in the blood vessel worksheet located on Blackboard. Okay, so let's look briefly at veins. So on the vein picture, you're seeing the exact same thing, But now we are going to go towards the heart and we're draining blood from these body parts. So we're going to start at the bottom and work our way up. So find the femoral artery. The femoral artery, the femoral vein is going to drain blood from the femur. It's then going to empty into, meaning it's going to pool or combine with the external iliac, which is going to drain blood from the lower limbs. The internal iliac, again, we're on the upside down Y, kind of the V of the Y. The internal iliac is going to drain blood from the pelvic cavity. The common iliac, again, is kind of right there in the middle where that Y splits. Now you're going to see the stem of our Y, and that is our inferior vena cava, and we're headed back up to the heart. So if you recall, the inferior vena cava drained blood from below the diaphragm, which looks to be the case. We're headed back up to the heart. That inferior vena cava is going to dump its blood or empty its blood into that right atrium. Think of our blood flow discussion. Now let's go to the top of your heart. So now the jugulars, external and internal, they're going to empty blood into your veins because they're veins. And if you follow along, there's also a page in that blood vessel worksheet that says the flow of blood in veins, and it kind of shows what's emptying into what. They're going to empty into the subclavian. Again, the subclavian are right below your clavicle. The subclavians are going to empty into the brachiocephalic. And now we're back to that superior vena cava. That superior vena cava was one of the 3 major veins that emptied blood into the right atrium. And now we're ready to go back over our blood flow, go back to that very first PowerPoint presentation. So right atrium to tricuspid valve, etc. So you should be able to label and know which parts do what. So these are just some up close views. So in this picture, you can see the aorta, and we have that aortic arch. This is a nice view of the 3 major branches off the aorta. So if I said, what are the 3 major branches? This is also on the heart picture you were asked to label in the PowerPoint packet. It would be brachiocephalic, left common carotid, and left subclavian. You only have 1 brachiocephalic artery, but you have 2 brachiocephalic veins. You could also see in this picture that the brachiocephalic then splits into subclavian and right subclavian and right common carotid. Okay, this is, again, the same picture, just showing kind of a different view. So this shows aortic arch. We see that brachiocephalic. From there, we can see that right subclavian, which becomes the axillary. You can do this a little bit bigger. The brachial to radial and ulnar. We see the left common carotid and the left subclavian on the other side, those major branches off the aorta. This is showing the branches in your abdomen. So this is back to arteries. So you see that nice, big, huge abdominal aorta. And off of that, you can see the renal supplying blood to the kidneys. When we get to urinary chapter, we'll talk about that again. You can also see the superior and inferior mesenteric branching off the abdominal aorta. And you can see the common iliac and the internal iliac. Same concept, but now with veins. And if we're not mentioning that, you don't have to know them. So if you see like azygous or cephalic, those are ones you don't have to know. You only have to know the ones on the worksheet. This is showing, again, the lower half. So this is from the diaphragm down. So now we're looking at the inferior vena cava vein. We can see the renal, again, going away from now. We're draining blood away because remember, veins carry blood towards the heart from the kidney. You can also see that upside down Y, and we can see the iliacs, both internal and external.